Hello, I'm Bill Brooks. I'm a neurosurgeon and chairman of the Neuroscience Center. The Neuroscience Center is a dedicated center in a community hospital that brings both evidence-based medicine and new innovative medicine and techniques for care of the central nervous system and peripheral nervous system. I'd like to introduce to you Paula Gisler, who is our administrator, director of the Neuroscience Center. Paula, I'd like to take you through a tour and see what we have to offer.
Yeah, so what are we going to look at today?
We're going to look both at our memory program, our multiple sclerosis program, our other neurological programs, as well as the surgical programs that are very innovative and new and bringing new techniques for surgical treatment.
Great. Well, let's head out.
Let's head out.
Okay.
Hey, Curtis. Paula, this is Dr. Curtis Given. He's our neurointerventionist here at the Neuroscience Center. Curtis, what you got going?
Yeah, so this is an interesting case. This is a 67-year-old who had presented to the ER with symptoms of a severe stroke. He couldn't move one side of the body, he had a facial droop, and we did imaging studies that showed that he had one of these large vessel occlusions, one of these major blood vessels in his brain that had been blocked. And he had a contraindication for getting TPA, the clot-busting medicine for stroke. So one of the beautiful things about Baptist Health Lexington is that patient then immediately comes to the cardiac catheterization suite, and we did an angiogram, and you can see where his blood vessel was occluded right here. There's this whole area of the brain that's starving for blood on him.
Isn't it?
Yeah, and we were able to use some of our new devices that go up and physically pull the blood clot out of the head, and in his case got a very dramatic result. We were able to do this with one passage and completely open up this whole blood vessel and pull out a large blood clot. And he's one of our more impressive responses in that he immediately improved on the cardiac catheterization table, began to move his arm and his leg, said he felt much better. His whole case took less than a half an hour to do.
That's incredible.
Yeah.
Really incredible. And the patient, is the patient doing well? I mean,
he's back to complete normal. So we judge strokes by an NIH stroke scale, and the bigger the number, the worse you are. And he came in with about a 17-18, which is a severe stroke, and he was back to 0 the next day, which is normal.
Well, the hospital's really lucky to have this technology and to have your expertise in doing this. It really gives patients every chance that they can possibly get.
Pretty impressive. Well, Paul, let's go down to see Dr. Alan Beckman down at the CyberKnife and show you some more toys.
Yeah, that's a pretty impressive thing down there. That technology is something. Thank you.
Paula, this is Dr. Alan Beckman,
Hey, Dr.
who
Beckman.
is in
Good
charge
to
of
see
the
you again.
CyberKnife
Yeah,
and the
sure.
radiation oncologist we've been working with here at the Neuroscience Center. And I thought you might like to meet him and let him tell you about what we do here.
Yeah, please. How did all this get started, Dr. Beckman?
We acquired a CyberKnife about 8 years ago, and that is a robotic radiation treatment delivery machine.
Wow.
So it allows us to treat with focused radiation beams outside of the brain.
Mm-hmm.
We can treat brain tumors or spine tumors. It's an alternative to surgery for some patients who either can't have surgery because the tumor's in a bad location, or for a patient who can't have anesthesia or would have too many complications if they underwent surgery.
What a great tool.
Well, tell me about the advantages of CyberKnife. How does it help us out?
Typically, patients go through it with very little side effects or problems and do not typically have the redness of the skin or hair loss they would experience with conventional radiation treatments. We can usually treat brain tumors in one treatment or very few treatments.
Wow.
It's an outpatient procedure. It's painless. Treatment takes anywhere from 30 minutes to 60 minutes in most cases.
That's great. Well, thanks a lot, Alan. We appreciate seeing your shop.
Thanks.
Hi, Brett. Paul, this is Dr. Brett Scott, who's dedicated to complex spinal reconstructive surgery.
It's a big word for putting spines together and making crooked spines straight. It's more than taking out a herniated disc. It's complex and it's reconstructive.
Hey, Dr. Scott.
Well, good
How are
afternoon.
you? What you got going here?
Well, actually, this is a new piece of technology that has really revolutionized our treatment of complex spine problems. The big machine you see here is the O-arm. It's an intraoperative CT scanner. It allows you to get two-dimensional images of the spine in the operating room. And then we take those data and those images and put them in a computer, and it gives us pictures and allows us, through what's called stereotactic navigation, to be able to find points of the spine that you can't see. For example, we have an instrument that the pretty smart computer, it knows where the tip of this pointer is. So if we put it on the spine, we can see in several dimensions where our probe is. Part of the utility of this instrument is to help us safely and accurately place screws in the vertebrae. And I can see right now from where I have my probe placed that I am pointing right down the pedicle in two dimensions here. So if I were to tap this, and I could put a screw that would go right down into the vertebra in just perfect position. It really has made the surgery so much safer and more effective, particularly in a patient who has an abnormal alignment of the spine. When the vertebrae are in normal alignment, we can do pretty well without the O-arm. But once you start getting curves in the spine and abnormal vertebrae, then it becomes much more difficult. We don't have the normal landmarks, and this technology really makes a big difference.
Hi, Dr. Cooper.
Hey.
Dr. Cooper is the medical director of our memory care program. And Dr. Cooper, can you tell us a little bit about what the memory care program is?
It's a multidisciplinary program aimed at trying to diagnose and help people with different memory disorders. Once we make an evaluation and a diagnosis, then we try to formulate a plan. And from my end, that may include medications or medical management. We'll also pull in social services to help with education and support of the caregiver. And if appropriate, we'll pull in other resources like speech pathology. They have programs like cognitive rehabilitation, helping people compensate for memory problems or, in a sense, just do a little bit better from a non-medication standpoint.
What kinds of treatments are there for Alzheimer's?
From a medical standpoint, there are a couple classes of medications that we generally call cognitive enhancers. People are able to be more independent for a longer period of time with these medications. In some cases, particularly early on, we'll work with speech pathologists to do something called cognitive rehabilitation. That's a way to help people draw on their strengths to compensate for any weaknesses such as memory.
That's a great program.
Yeah.
Sounds great.
Very much needed with the incidence of memory disorders climbing.
That's becoming a big problem.
Dr. Brooks, I wanted to introduce you to Dana Likens. She is one of the few MS certified specialists in our state, actually. And here is Dana Galloway, and she is our program coordinator for our MS program that we've started recently, and just wanted to hear from them what's going on with our MS program.
Great, I'd love to tell you about our MS program. I'm so excited that at Baptist Health Lexington we have the only comprehensive care MS center here in Lexington, and it's very exciting because for people with MS, it's such a complex disease. It hits them in the prime of their lives, and it affects every aspect of their lives. It can affect their mobility, their walking, their ability to talk, their thinking. It can affect their ability to work, to participate in their daily activities, their lives with their families. So it's really important for them to have comprehensive care. So with our comprehensive MS Center, we're able to provide that multidisciplinary care where we can meet with them and meet all of their needs, and we can provide those additional resources all at once and be able to provide them with the care that they need.
Dana, you're responsible for coordinating this program, so do you have some comments about what the options are for MS patients?
Yes, there are a lot of new IV medications out, and there are several new oral medications that have come out for MS patients, which is a wonderful option. There are new meds coming in the horizon, and Dr. Winkley is a specialist with these medications, and it's very important, I think, that MS patients find a neurologist who specializes in MS so that they really understand how the medications work and what is best for each patient.
Paul, that's a great program. The patients can come in with MS, get new and novel treatments, medical treatments, as well as the family gets treated as well and gets a comprehensive program of management, physical therapy, speech therapy, occupational therapy. That's a great program, very, very comprehensive.
Right. Well, we're hoping that that's what it is, something that can meet, the total patient
Yeah, that's
needs.
great. Well,
Yeah.
thanks a lot. Thank
Sure.
you all.
Yeah. So what do you think of our little tour, Dr.
Well,
Brooks?
did you enjoy it? It was, we're at the close of it, and we've
Right.
seen lots of interesting things and met lots of interesting people.
Right.
They're doing some really interesting stuff, which I think is all there available at the Neuroscience Center.
Right. Well, we have great patient care, and we have high tech, and then we have low tech programs. But aside from that, we really also, as important as our technology is our commitment to patient care, and the fact that we really believe in our neuroscience program that if we get patient care right and we're committed to that the rest will take care of itself. So that philosophy is equally important to any technology or personnel or anything that we can offer, and we do have that at Baptist Health Lexington. So, and we have great doctors. Thanks so much.
Glad you enjoyed it.
For your commitment and your persistence and your push to always make us better.
I'm
Dr.
sure I'll
Brooks.
see you around.
Yeah, will do. Thanks.